Hello, it is time for another study session. We're going to go over the spine and thorax muscles. The erector muscles lie deep to the lumbar region to what connective tissue structure? The thoracolumbar aponeurosis. An aponeurosis is a broad flat tendon, and there's one big broad flat tendon on your lower back called the thoracolumbar aponeurosis. The erector muscles lie deep to that muscle, that aponeurosis, which movement of the vertebral column would shorten the fibers of the erector spinae muscles. But since the erector spinae muscles lie on either side of the spine, and they're very long, they are going to contract and help us to extend our spine, or help us to maintain posture. Okay, so which of the following is a part of the origin of the spinalis? The spinalis muscle originates from the spinous process of the upper lumbar and lower thoracic vertebrae. So the upper lumbar are in this area, and the lower thoracic are also. So this spinalis muscle attaches on that lower area of the back. Which of the following is part of the insertion of the spinalis? The spinous processes of cervicals, except for C1. The cervicals are up here in the neck. So that muscle runs all the way up the back and attaches on all the cervical vertebrae, except for C1, which is the very top one near the skull. Which of the following is an action of the spinalis? Extend the vertebral column. Extend. Which of the following is a part of the origin of the longissimus? Transverse processes of the upper 5 thoracic vertebrae. Transverse processes of the upper 5 thoracic vertebrae. Which of the following is part of the insertion of the longissimus? The mastoid process of the temporal bone. So, the longissimus goes all the way up the back and attaches to the back of the skull on the mastoid process, which is the little bony knob on the back near the ear. It's the only erector spinae muscle that attaches on the skull. Which of the following is an action of the longissimus? It laterally flexes the vertebral column to the same side. Lateral flexion is like this. And so, the longissimus laterally flexes the vertebral column to the same side. The same side that the muscles on, that is. Which of the following is part of the origin of the iliocostalis? B. Posterior surface of the ribs 1 through 12. So, all your ribs. And it's on the posterior. So, the iliocostalis attaches to the ribs in the back. Which of the following is an action of the iliocostalis? The iliocostalis laterally flexes the vertebral column to the same side, depending on what side we're talking about. Which of the following is an insertion of the iliocostalis? The insertion of the iliocostalis is the transverse process of the lower cervicals. So the lower muscles, the lower spinous processes. The transverse processes of the lower cervicals. So the lower cervical spine vertebra, that's what I'm looking for. The vertebra in the neck, that is where the iliocostalis inserts, and it helps us pull like that. Which of the muscles in the erector spinae group have an attachment on the skull? Longissimus. Longissimus, as we spoke of before, has an attachment on the skull. To contract the lower fibers of the erector spinae group from a prone position, you could ask your partner to perform what action? So the erector spinae group can be, the lower fibers of the erector spinae group can be contracted in a prone position, which is lying face down. If your partner alternately raises and lowers his or her feet. When exploring between the scapulae, through which muscle tissue must you palpate to access the erector spinae fibers? Between the scapulae, there is the trapezius and the rhomboids. If you palpate through them on either side of the spine, you will feel the erector spinae group. In contrast to the erector spinae group, the fibers of the transversus spinalis group run in which direction? Diagonally. The transversus spinalis group are the multifidi and the rotatores, and they are small muscles in between the vertebrae, and they run diagonal. They're little short muscles that help us rotate our spine. Rotate. So, alright, now that we've got that down, which are the only muscles with fibers that lie across the posterior surface of the sacrum? The multifidi are the only muscles with fibers that lie across the posterior surface of the sacrum. Which muscles of the transversus spinalis group attaches at the cranium? The semispinalis capitis. The semispinalis capitis attaches to the cranium. Which movement of the vertebral column will lengthen the fibers of the multifidi on the right side of the body? Rotation to the right will lengthen the fibers of the multifidi on the right side of the body. Which is the origin of the multifidi? Sacrum and transverse processes of lumbar through cervical vertebra. So the sacrum and transverse processes of the lumbar all the way to the neck, the cervical vertebra. Which is the insertion of the multifidi and rotatores? D. The spinous processes of lumbar vertebrae through second cervical vertebrae. Which of the following is an action of the rotatores? Sounds like rotate. So, rotate the vertebral column to the opposite side. Which of the following is an action of the multifidi? Extend the vertebral column, but also rotate. Next question. The rotatores span between how many vertebrae? B. 1 to 2 vertebrae. They attach at one, they skip 1 to 2 and attach at the other one. The multifidi span between how many vertebrae? Multifidi span between 2 to 4 vertebrae. That means they're longer. They attach to one vertebra and they skip 2 to 4 and attach to the other one. Which is the origin of the semispinalis capitis? D. The transverse processes of C4 to T5. That is a nice little short muscle in the neck, attaches to C4 to T5. And which is the insertion of the semispinalis capitis? Between the superior and inferior nuchal lines of the occiput. Those are just landmarks on the skull. At the base of the skull, this muscle attaches. Which of the following is an action of the semispinalis capitis? Extend the vertebral column and head. So it assists with all of that, but mostly it extends the head. Which movement of the vertebral column will shorten the fibers of the semispinalis capitis on the right side of the body? Extension. Extension will shorten the fibers. Those fibers are shortening when they are being used. So extension. There you have it. The spine and the thorax. Ready to ace this test? Yes! Ha ha!